Metformin is the first drug of choice for treating type 2 diabetes. If metformin alone is not sufficient to lower and control blood sugar levels, one of several other medications can be added. One of the most serious complications of type 2 diabetes is heart disease. What is the best drug to add to metformin to protect the heart? Scientists at Seoul National University and other research institutions in the Republic of South Korea conducted a study to answer that question. Their research, reported on in PLOS ONE in May 2015, included 349,476 people diagnosed with type 2 diabetes and treated with oral medications. It was found 3,881 of these diabetics developed heart disease. The diabetics who used metformin plus sulfonylurea had a 20% greater risk of any heart and blood vessel disease than those who took metformin together with a DPP-4 inhibitor. Their chances for a heart attack were 25% higher, and their risk of heart failure was raised by 51%. The risk of heart and blood vessel disease were 11% lower for metformin and pioglitazone and over 5% higher for heart attacks, over 4 times higher for heart failure, and 19% lower for strokes. From this information it was concluded a combination of metformin and a sulfonylurea carried a higher risk of heart and blood vessel disease, heart attacks, and strokes when compared with metformin and DPP-4 inhibitors. The combination of metformin and pioglitazone was associated with a lower risk of total heart and blood vessel disease and stroke, but a higher risk for heart attacks and heart failure. Perhaps diabetics at high risk for strokes should be given pioglitazone, and those at higher risk for heart attacks and heart failure should be given DPP-4 inhibitors with their metformin. This is something that should be discussed with the type 2 diabetics doctor. Pioglitazone is prescribed at 15 mg or 30 mg once a day. It is given at 15 mg only to diabetics with mild to moderate heart failure. It is not recommended for anyone with severe heart failure. It works by making the body more sensitive to insulin. DPP-4 inhibitors are the gliptins, sitagliptin, saxagliptin, and linagliptin. Sitagliptin is taken in doses of 25 to 100 mg per day. Saxagliptin is prescribed at 2.5 to 5.0 mg a day. Linagliptin is taken at 5.0 mg per day. The gliptins indirectly help the pancreas to make more insulin.